support progressive journalism, like, share and subscribe to our YouTube channel. Don't forget to press the bell icon for latest updates.
Introduction, and it's indeed a great pleasure to be amongst the delegates, members, and of the MUN and the board. And after an inspiring speech by Mr. Rahman Khan, it is really a very proud moment for me to share my views with all of you. And let me begin by thanking Mrs. Manju Balasubramaniam, Principal DPS, as well as Mrs. Sujata, Coordinator DNMU, and for this kind invite and the opportunity to speak on the ethical considerations that are needed in the response to the pandemic. I hope this will be able to give you some new insights and to understand why an ethics framework is important and can help to make our response more responsive. So we all know about this pandemic, which happened, and there were earlier pandemics, epidemics and outbreaks that happened. They were recently witnessed in India, such as H1N1, Ebola, SARS, Nipah, Zika, etc. But they were successfully tackled through appropriate research. India, with its 1.4 billion population residing in densely populated areas, is at constant risk for any emerging outbreaks. The present pandemic is an unprecedented situation with socio-economic impacts, and it has disproportionately affected the low and middle income countries, and especially the resource-constrained populations. Pandemics create inequality and inequity and tear apart the delicate social fabric. At the global level, there are ongoing debates on vaccine nationalism, trade policies, access, drug pricing issues, bringing about waiver on intellectual property rights. And these discussions are needed to ensure that not only the rich, but all nations in the world can get rightful access to ways of controlling the pandemic. According to DG WHO, Dr. Tedros, he said, none of us are safe until all of us are safe. So we all need to move together. We need global solidarity to fight the pandemic. What is also needed is ethics preparedness, which requires integrating the core values of ethics into the scientific evidence-based decision-making so that science is more holistic, sensitive, and people-centric. ICMR has brought out several guidelines, and 2017 brought out a national guideline, and then recently, last year in April, we brought out another guideline, and that was, a detailed guidelines to help in the review of research, because we needed really fast-track research during the lockdown situation. So some of the principles that are highlighted in the guideline I'll be discussing. So in a public health emergency, it may become essential to deploy very restrictive measures that limit individual freedom and rights to contain the spread of the disease. For example, social distancing, isolation, quarantine, you all know about it. And that creates an ethical tension that may expose people to have suffer from stigma, stress, or even violence. Some people may become particularly vulnerable and need more protection. Safety of healthcare workers has to be a top priority, and they should have access not only to good quality protection here, but also need psychosocial support to safeguard their mental health and well-being. Collaborations and partnerships are needed to share knowledge and expertise. For example, the international genomic consortiums which have been formed to keep a watch on genomic surveillance to combat the new emerging variants of the virus. And these collaborations need all countries to come together to share their data and intellectual property and to form collective responses to preserve lives. The principle of beneficence, or to do good, there is an ethical standard of duty to care by health professionals. Over the past years, ICMR has developed national network of surveillance laboratories, and you have all heard about those. There have been rapid responses from Ministry of Health in implementing strict quarantine measures, contact tracing, Arogya Setu and other apps, which have been augmenting the use of big data analytics and helping in breaking the chain of transmission. And ethical practices emphasize the duty to plan also beforehand, to have a system in place to provide access to all levels of people to healthcare to maximize the benefits in the time of need. It is also important to engage with the communities, protect societal values, and improve communication, which is very critical in building trust. Simple key public health messages and responsible use of social media platforms can greatly help in gaining public trust and being more sensitive to the needs of the population. To create awareness, it is important that information must be communicated in a clear, honest, and timely manner. But what we have seen has been an infodemic, a term coined by WHO last year because of the incorrect information and rumors floating around social, electronic, and print media. Media has an important responsibility as well to mobilize the communities or to help in the underprivileged sections of the society to spread awareness, to not create false alarms, anxiety, panic, and not lead to a psychological pandemic. We have seen enormous scarcity of infrastructure and healthcare resources. Difficult decisions have to be made about how and to whom resources should be allocated. The primary obligation is to protect our frontline workers as well as those who are prone to rapid spread of disease, such as those living in crowded conditions or slums, or high-risk groups such as senior citizens or people with comorbidities. And priority decisions regarding resource allocations should not be discriminatory based on sex, race, religion, or your social status. The country must protect the employment rights of the citizens, provide financial support to the needy, such as daily wagers, who have lost employment. In the long run, the governments have to strive to sustainable methods of self-sustaining through mobilizing the local industries. The question is, what is fair and equitable way of distributing these limited supplies, such as those of vaccines? There are national responsibilities as well as cross-border responsibilities, as we know that the virus does not see any boundaries. If the low and middle income countries do not get access to vaccines, the virus is going to stay here and the new variants may prolong the pandemic. Vaccine nationalism that we are seeing of rich nations is going to do a lot more harm. This is another example to see why we need to integrate ethical reasoning in the policy making processes. Ethics preparedness is actually critical to finding humane solutions. Let us focus on issues like availability and affordability and accessibility of treatments, diagnostics, vaccines, maintaining social context, care of differently abled, weaker sections of the society, and build public confidence. Ethics preparedness can help guide fair decision-making in the best interest of the populations, and together the nations can save human lives. So these issues really need wide discussions and deliberations, and platforms such as DNMUN actually provide that unique opportunity to the young minds to come together and inculcate critical thinking and awareness of the complex problems that are facing the world today. So thank you very much for the opportunity. It was a pleasure to be here today.